Hello everyone. The next developmental disturbances affecting the shape of tooth, that is taurodontism. I'll discuss taurodontism in detail in this video. The term taurodontism was originated by Sir Arthur Kate in 1913 to describe a peculiar dental anomaly in which the body of the tooth is enlarged at the expense of the roots. The term taurodontism, that means bull-like tooth. Tauro means bull, don't means teeth, and it is derived from the similarity of these teeth to those of ungulate or cud chewing animals. Scientists Shaw classified further taurodont tooth into hypotaurodont, mesotaurodont and hypertaurodont forms. Hypertaurodont form being the extreme form in which the bifurcation or trifurcation occurs near the apex of the root, and hypotaurodont form being the mildest form. Next is etiology or possible causes for taurodontism. It is due to a specialized or retrograde character. It is a primitive pattern, or maybe a Mendelian recessive trait. Atavistic feature, that is ancestral origin, and there is a mutation resulting from odontoblastic deficiency during dentinogenesis of the roots. Hammer and his associates believe that it is due to failure of hers, that is Hartwig's epithelial root sheet, to invaginate at the proper horizontal level. Then the clinical features of taurodontism. Affected teeth tend to be rectangular in shape and exhibit pulp chambers with a increased apico-occlusal height. There is increased apico-occlusal height and a bifurcation that is close to the apex of the root. The diagnosis is usually made subjectively from the radiographic appearance. So the degree of taurodontism has been classified into mild, moderate and severe form according to the degree of apical displacement of the pulpal floor. In the picture you can see there is first picture, it is a normal tooth with normal apico-occlusal height. In mild, moderate and severe form, as the degree increases, the apico-occlusal height also increases. Taurodontism may be unilateral or bilateral, and it affects permanent teeth more frequently than deciduous teeth. There is no sex predilection and the prevalence is highly variable, that is from 0.5 to 46%, and most likely it is related to different diagnostic criteria and racial variations. When this occurs, the first molar is usually affected least, with increasing severity noted in the second and third molars respectively. Taurodontism may occur as an isolated trait or as a component of a specific syndrome. There is an increased frequency of taurodontism has been reported in patients with cleft lip or cleft palate. There are some useful biometric criteria for the determination of taurodontism were presented by Victor and colleagues. These reports contain information that is useful in epidemiological studies of the process. Some investigators include example of taurodontism in premolar teeth, and some investigators argue that taurodontism is not shown by premolars. This argument is academic because the presence of taurodontism in premolars cannot be documented in situ. So, investigations of taurodontism in premolar teeth require the examination of extracted premolars because the necessary radiograph depicts the tooth in a mesiodistal orientation. Some investigations have shown that taurodontism may develop in the presence of any of a large number of different genetic alterations. These findings suggest that chromosomal abnormalities may disrupt the development of the tooth's form, and it is not the result of a specific genetic abnormality. Then radiographical features of taurodontism. The pulp chamber, you can see in the radiographic picture, the pulp chamber is extremely large with a much greater apico-occlusal height than the normal tooth, and the pulp lacks the usual constriction at the cervical third of the tooth, and the roots are exceedingly short. The bifurcation or trifurcation may be only a few millimeters above the apices of the roots. Then treatment for taurodontism. Patient with taurodontism require no specific therapy. Coronal extension of the pulp is not seen. Therefore, the process doesn't interfere with routine restorative procedures. Some investigators have suggested that the taurodontic shape may exhibit decreased stability and strength as an abutment tooth in prosthetic procedures. But this hypothesis has not been verified. If endodontic therapy is required, the shape of the pulp chamber frequently increases the difficulty of locating, instrumenting and obturating the pulp canals. So these are the treatment for taurodontic tooth. So these are all about the taurodontism, basically the clinical features, how the tooth looks like and how the tooth looks in a radiograph, and the treatment for a taurodontic tooth. So I hope you like this video. Thank you so much.